carpal tunnel syndrome. Now, all of the students, please have a look at this picture first, and then we will move further. What is shown here? What is this carpal tunnel all about? If you see this, you can clearly get the picture. See there, please. So which nerve is involved in carpal tunnel syndrome? That's the first question. What is the answer? It is
Median.
Median nerve.
Median nerve.
exactly. This is median nerve. That's the first thing. And what is this carpal tunnel means? See here. This is known as flexor retinaculum. Flexor retinaculum. This is a fibrous septa-like structure, okay, which is forming a tunnel there. Okay, and this tunnel is called carpal tunnel. These are the carpal bones which are present here. This tunnel is present between the carpal bone and flexor retinaculum, and median nerve and radial arteries are the two very important structure which passes through this carpal tunnel. If this median nerve is compressed, then carpal tunnel syndrome can occur. Now, with this discussion, let's come to the slide. This is compression and ischemia of the median nerve in the carpal tunnel, which is deeper to the flexor retinaculum of the wrist. You have to remember this term, flexor retinaculum here. Okay, so compression, and after compression there is ischemia, compression of the median nerve in the carpal tunnel deep to the flexor retinaculum of the wrist. It commonly affects the woman ages 30 to 60 years, but it can also occur in male. The common causes of carpal tunnel syndromes are idiopathic. We don't know the cause. What is the main factor behind it? But it is happening to so many people. So idiopathic, pregnancy, obesity, occupation, and trauma. So let me highlight a little bit about this. This carpal tunnel, okay, has to have something there. Then only the median nerve is compressed, isn't it? It has to have something there. Either there is a mass there, okay? Either there is a mass, either there is a collection of fluid, or there is an edema, either there is some other tissue, okay, which is growing, either there is a prolonged compression, something like that. So just think in that direction, your answer would be very easy. Pregnancy. In pregnancy, there is a retention of fluid in the body. There is increase in plasma volume. So probably that is the cause for compression. Obesity. There is fat. Occupation. Okay. If somebody is typing all the time, on their computer or on their typewriter or something like that, then because of the position, they can easily have carpal tunnel syndrome development later on. And trauma, okay, quite easy to explain. The trauma can cause a fracture of the distal end of the radius, okay, and that callus which is forming during the fracture healing can simply compress the median nerve. So this is how we can explain. Some other causes are still there, okay? We'll talk about that. Let's move on. Now, again, a little bit anatomy here. See this? This is called flexor retinaculum, which is clearly shown here in the picture. These are the flexor tendons, okay? Flexor tendons. These flexor tendons are originated from the forearm, and they are going on the palm and inserted in different areas. And this is the median nerve, which is passing underneath the flexor retinaculum. Now, look at this picture and tell me which structure in the hand are supplied by median nerve. Yes, which structure?
The nerve muscles and palmar aspect of sensory sensory palm aspect.
Okay, good answer. Anybody else? Anything he has missed or something like maybe? Yes? Anybody? Look at the other picture also, okay? Maybe you get certain clue from there. The other one. Now, regarding the muscles which are supplied by uh, the median nerve in the hand. So let me mention the muscles here. These are muscles of thenar eminence or thenar group. Muscles of thenar eminence or thenar group except adductor pollicis. Except adductor pollicis, because adductor pollicis is supplied by ulnar nerve. This is one. And another is first two lumbricals. First two lumbricals are also supplied by median nerve. And these lumbricals are the muscles, very small muscles of the hand. Okay, so remember these important points. These are the motor functions. What about the sensory? The sensory you can clearly see here. See this. The when we put our hand in the anatomical position, okay, when we put a hand in the anatomical position, the radial side of the fourth finger, this is called radial side of the fourth finger, this is called ulnar side. Okay, the radial side of the fourth finger along with all other three fingers, this is the middle finger, this is the ring finger, and this is the thumb. The palmar aspect of these, all of them are supplied by median nerve. Now, which is the territory of the ulnar nerve here? Ulnar nerve is not shown here, okay? But you can clearly find it out. Just look this. The ulnar aspect of the fourth finger and the whole of the fifth finger on the palmar side is supplied by ulnar nerve. This is the ulnar nerve territory. Not only here, okay, the nail bed is present on the dorsal side, right? The nail bed of these fingers are also supplied by median nerve and the ulnar nerve. The ulnar nerve supplies the ulnar territory, for example, the nail bed of this fourth finger and the fifth finger, but the nail bed of third, second, and the first are supplied by median nerve. This is one important point which many of us miss, because we believe all of the back side is supplied by radial nerve. That is not the case. The nail bed are supplied by median nerve. Now it will be very easy for you to answer what happens if the median nerve is damaged here. So the thenar group of muscles will suffer, lumbricals, the first and second, will suffer, and this sensory innervation will suffer. This is the importance of knowing anatomy. Now, see there another picture, okay, but the message is the same one, just a bit of revision. This is the flexor retinaculum, the transverse carpal ligament is another term. These are the flexor tendon. A lot of flexor tendon are passing through that carpal tunnel, and median nerve is also there. See here, okay. And these are other cross section or other types of pictures. Now, what are the other causes for carpal tunnel syndrome? What are the other disease where carpal tunnel syndrome can occur? Rheumatoid arthritis, acromegaly, diabetes mellitus, and even heart failure. Now, if you think about those description which I just told you, then some reasons have to be given against each of the disease again. Rheumatoid arthritis, okay, is a connective tissue disorder. It's a generalized type of connective tissue disorder where joints are affected. The joints, the small joints of our hand are mainly affected. So you can easily give reason like that. What is acromegaly? Yes.
Excessive secretion of growth hormone after
growth hormone in the adult.
Increase growth hormone after puberty.
Exactly. release of excessive growth hormone after the fusion of epiphysis. After the fusion of epiphysis or in the adult life, results in acromegaly. And one of the important feature of acromegaly is all of the soft tissue will increase in size. Even the bones increase in size, not in the length but in the width. Okay, they can be look a little bit bigger. So this, it can easily compress the nerve there. Diabetes, okay, because of some related problems, again cause this carpal tunnel syndrome. Neuropathy can also occur in diabetes, and congestive heart failure again is a case of edema. Now the most important part, how to diagnose it. What are the clinical features of carpal tunnel syndrome? If this type of patient comes to you, how can you reach to the diagnosis? See there, the patient may present with pain, okay, and paresthesia in the distribution of median nerve in the hand. These are sensory symptoms, pain and paresthesia. Paresthesia is tingling and numbness. It is an abnormal type of feeling there in the distribution of median nerve in the hand. That's what I told you just now. Which are those finger which are supplied by median nerve? So exactly that side the person is having pain and paresthesia. Wasting of the thenar muscle. The thenar eminence is atrophied. Okay, it looks wasted. The typical bulb of the thenar eminence is lost. The pain is worse at night, especially in early morning hours. Probably the compression is more during that time. It is relieved by hanging the arm out of the bed and shaking it. This is one of the typical history the person is providing. Okay, and it helps us in the diagnosis. During the day, little pain is felt unless the wrists are held still. Probably there is a movement, again, when we move the wrist, probably the compression is a little bit less. And the daytime symptoms are worse if pronator syndrome is present. And pronator syndrome means the median nerve, remember, in the forearm, okay, just below the elbow, enters into the forearm by passing through pronator teres muscle. So sometimes that pronator teres muscle will give compression to the median nerve, and this is known as pronator syndrome. So many other clinical features will be present apart from features of carpal tunnel syndrome in pronator teres syndrome. Now, see this? This is a very beautiful picture, okay, which is showing us a lot of important clinical features of carpal tunnel syndrome. So have a look here. So this is the sensory problem. See this? These are the area which are supplied by median nerve. So there is a numbness and pain in this area. And look at this. Where is the thenar eminence here? It is atrophied already. This is the area of thenar eminence. It is atrophied. Okay, so this is carpal tunnel syndrome. There are certain diagnostic tests you can do in a patient. So what are those? Just to make sure you have already suspected carpal tunnel syndrome from those important symptoms and signs. But what are the diagnostic tests we can do? One is called Fallon's test. Okay, Fallon's test. This Fallon's test means ask the patient to hold, okay, both wrists flexed for 1 to 2 minutes to see if this worsen or reproduce the symptom. So what we ask the patient to do, just flex both wrists for 1 to 2 minutes. On the side where there is a carpal tunnel syndrome, there is more compression to the facial nerve, median nerve than the other side. And as a result of this, whatever symptoms the patient is already having, they become worse. Or if the patient is not having any symptom till now, the symptoms will be produced. This is called reproduction of the symptoms. This is the meaning. This is called Fallon's test. One of the very important question you may get in the exam. Okay, remember this. How the question may come. Fallon's test is done for the diagnosis of which of the following condition, and your answer is carpal tunnel syndrome diagnosis. Or if the median nerve is there somewhere, then they may want you to choose that. Another type of diagnostic test is called tourniquet test. Now, how this tourniquet test is done? We apply sphygmomanometer cuff or blood pressure cuff just above the systolic blood pressure for 1 to 2 minutes to see if this reproduces the symptom again or not. Now, if you remember, similar type of test can be done for the diagnosis of some other conditions also. Anybody, what is that condition where we use the sphygmomanometer above the systolic blood pressure to produce some of the symptoms?
Hypoglycemia.
Very good. Hypocalcemia. What is the name of that sign? What is the name of that
Trusu
sign?
Trusu sign.
Trusu sign.
Trusu sign.
Excellent. Very good. We recently discussed that. Okay, in the topic of calcium metabolism disorder. Very good. So this is the way to correlate the things. Same type of procedure here. You apply the sphygmomanometer cuff. Okay, find out the systolic blood pressure for the patient. Okay, take the pressure a little bit above the systolic blood pressure for about 2 minutes and see whether there is a tingling and numbness in the territory of the median nerve in the wrist, the hand area or not. This is the way. And in nerve conduction test, you stimulate the median nerve for pain sensation. Just tap, okay, just tap that area, tap that flexor retinaculum area and see whether the patient is complaining any pain and abnormal sensation in the territory of the median nerve or not. So these are the 3 important type of tests. Now, the final part is the treatment. So how we do the treatment here? The first type of treatment is the conservative one. Conservative treatment, and in this case, the wrist splint are applied at night to prevent the flexion, because flexion is causing all the problems there. If you do not flex that wrist area, then probably median nerve is not compressed and the clinical features are not produced. So wrist splint are the important part of the management. Regarding the surgical treatment, we can divide the flexor retinaculum and decompress the nerve. Divide the flexor retinaculum and decompress the nerve. Many of the causes are compressing the nerve there. Okay, probably you cannot go for the quick treatment of those causes, remember. So what you can do for the quick relief, you divide that flexor retinaculum, and this is known as decompression of the nerve. And at the same time, you can go for the treatment of those particular causes like acromegaly, like diabetes, like rheumatoid arthritis, isn't it? The treatment has to be provided. And don't forget, hypothyroidism is one of the common cause of carpal tunnel syndrome. Hypothyroidism, because of the collection of mucopolysaccharide like substance there. Okay, let's move on. We're coming towards the end of this topic. See this? So this is the type of splint which is provided so that the wrist will not be flexed, and we ask this type of things. The patient should wear it at night and go for the sleep. This is the surgical management. You excise that area, okay, open that area and cut this flexor retinaculum. This is called decompression of the median nerve. See this flexor retinaculum, a transverse carpal ligament is cut. Okay, this is the incision given, and after you open that site, cut it, okay, and resuture it. This is called carpal tunnel surgery. This is not a big type of surgery. Okay, it easily can be done as OPD basis. Now these days, okay, our medicine has advanced a lot. So this is the endoscopic carpal tunnel release, or surgery done through the endoscopes. So small incisions are given, endoscope is inserted inside, and the flexor retinaculum is divided. So this can be done. See here, it is divided and the median nerve is freed. Now, many of us can develop carpal tunnel syndrome if we do not, okay, make sure that our working environment is better or acceptable for our position or for our body. Now the person who are working all the time in the office, okay, in the table, they're working in front of the computer, they are the person who develops carpal tunnel syndrome very commonly. So what can we do for the prevention? So let's talk something about that. Take regular breaks away from your computer. Do not keep on typing there. Okay, and make sure when you type, your wrist, okay, is not in contact with the edge of the table. Okay, if it is continuously in contact with that, probably you keep some cushion there so that the edge of the table doesn't uh, you know develop friction against the wrist. This is one important point. Another is, see here, sit with your computer screen at eye level and your knees slightly lower than your hip joint, so that your position will be good enough to decrease the friction at the wrist. Let your feet sit flat on the floor and not tucked under your chair. There is an easier position. Keep your shoulders and back relaxed. Do not slouch. Okay. Do not kneel further. And then have your computers in front of you rather than at the side where you have to crane your neck. Now, why all these things are shown here? Just to decrease the chance of development of carpal tunnel syndrome. And the most important for me is this one. Let the wrist rest on the desk in a neutral position using a comfortable pad to avoid the flexing or extending your wrist for too long. This is the most important step among all. But all those abnormal posture is causing this wrist to get more friction by the edge of the table. So if we do this, then the chance of carpal tunnel syndrome would be less, in the clinical practice. And at the same time, all those diseases, remember, they themselves can lead to carpal tunnel syndrome even without this type of posture. Okay, so if they are the cause, we need to go for the diagnosis and then the treatment. But let me tell you again, it takes a bit of longer time to treat those diseases because they are the chronic illness, most of them. So patient may not get better very quickly. So decompression surgery is a quick relief from carpal tunnel syndrome, but at the same time we keep on continue to treat those diseases. With this, let me stop here for today. Okay, thank you.